Coming up next on Primary Care, oral health, the importance of good oral hygiene to our overall health.
We see problems with infections in gum tissue that can actually result in death.
Hello, and welcome to Primary Care. I'm Dr. Lonnie Joe. Did you know that taking proper care of your teeth and gums can prevent or at least halt the progression of most diseases in your mouth? Yet millions of American children and adults don't care for their teeth properly and lack regular access to routine dental care. The people most affected are racial and ethnic minorities, the elderly and the disabled, and the poor. Here to talk about the importance of oral care and why it's particularly important to the Black community is my guest today, Dr. Raymond Gist. Dr. Gist practices general dentistry in Flint, Michigan, and has the notable distinction of being the American Dental Association's first African-American president. Dr. Gist, welcome to the show.
Thank you.
Good. Dr. Gist, is lack of access the issue that we're really facing here when it comes to the care of the teeth and the gums with the average American, and in particularly the minorities in this country?
That's one of the biggest reasons. But I also want to emphasize that there's a lack of awareness of the treatment that's available for our minority population right now. We in dentistry have been actively pursuing solutions to the lack of care for our population, especially African Americans, Native Americans, and Hispanics. What's available now is a program called Healthy Kids Dental, and most, if not all, children on Medicaid are eligible to get full services, probably by the dentist closest to them, for no cost to them at all. And the object is to get these mouths healthy, to get disease eliminated, and to get the mouths completely healthy, and then put them on a program where we can monitor them on an annual or biannual basis.
Everybody knows about having an aching tooth, but what are some of the problems that really need to be addressed and put into the forefront in terms of the problems that occur with poor or lack of dental care?
It really starts with children. And in the year 2000, Dr. David Satcher, the Surgeon General at that time, said that tooth decay was a silent epidemic. And he was correct, because it ravages the mouths. And even as patients are treated, usually on an emergency basis, that tooth decay comes back if those mouths aren't taken care of. And what we've been promoting, number one, is prevention. We try to eradicate this tooth decay and then prevent it from coming back. And there are a lot of things that we do in order to get it done. The primary being fluoridation of the water supply. But what we see inside the mouths and what you and our patients all see is a totally different thing. Once we look in the mouths of both children and adults, we see gums that are being infected with disease. We see mouth disease with tooth decay. We see signs of oral cancer. We see problems with infections in gum tissue that can actually result in death, which happened with one youngster in Maryland. This was about...
famous story now.
Yes, Diamante Driver. Right. He was 12 years old.
Right.
Suffered with a toothache, and it became infectious. The bacteria got in his bloodstream, traveled to his brain, and the bacteria infected his brain. He ended up getting major surgery, but it didn't save him. He died. Had it been diagnosed early enough, that tooth could have either been treated or taken out of his mouth, extracted, and it would have been at a price of about $100 or less. It was $250,000 that was spent trying to save his life, and it didn't work because it was too late for it to happen. And it's this type of thing, we emphasize prevention, and if we can get those children in our offices early enough, then we can prevent this type of thing from happening and also get these mouths healthy.
So from an educational standpoint of view, we need to be talking about not just the teeth but the gums and the rest of the structures in the mouth also.
Yes, we do. Absolutely. And at a young age, the first thing we want to do is get that tooth decay out of the mouths and teach those children how to maintain, how to brush, and when they're old enough, how to floss their teeth every day, preferably after every meal. And that would really get them prepared for adulthood when they'll already know how to maintain their teeth, and they can just continue that same process as they go back and are examined twice a year at a dental office. The adults that haven't had this training, we will usually present with gum disease. And the problem with gum disease is that there's no pain associated with it when it first starts. And what it does, those bacteria pretty much, you can say, eat away at the bone. And this happens without the knowledge of our adult patients. When they discover it, it's usually when the teeth start to loosen, because they lose bone around the roots of their teeth. And sometimes it progresses to the point where it's just not savable by the dentist, and those teeth have to be removed. That causes a problem because the other teeth in the mouth start shifting around. And that will result in bite problems when chewing. And also, if bone is lost with those other teeth, then the same kind of mobility or bone loss will happen, and more teeth are lost. And this is just a progression. This is something that we're aware of that is happening more often with our older patients, especially seniors. Our patients right now most in need, since we've gotten this Healthy Kids Dental program going, are seniors and disabled patients. And this is what we look for. Our seniors are taking a lot of prescription medications, and sometimes issues such as dry mouth because of the medication, issues such as what I mentioned, periodontal disease. We have detected diabetes because they're slow healers, and signs of infection with the gum disease has been actually determined that it could lead to problems with the heart.
That's so true. We'll touch on that a little more from the other disease aspect that actually can be seen in the mouth. I mean, I ask the patient to open their mouth, stick a tongue blade in, and say, that's what we do as treating physicians all the time, but that is the gateway to a lot of other disease processes that are occurring in the body. We're going to take a quick break, and we'll be right back with more of primary care.
There's no antidote for lead. So we are building this model public health program. Donating to Flint Kids will help us support access to nutrition, universal preschool, access to a pediatrician. If there was ever a time to invest in our children, it is now.
We're here with Dr. Raymond Gist, an accomplished dentist here in Flint, Michigan, and the former president of the American Dental Association. Dr. Gist, a lot of people only think that, it's just teeth and gums in the mouth, but help our viewers understand what periodontal disease is and what gingivitis is.
We have a lot of fancy words in dentistry, and that's a concern for us too, because now we're trying to break that message down into words that our public can understand. Periodontal, it derives from periodontium, and that's what gums are called. They actually connect the roots of the teeth to the bone and the teeth to the mouth. And it's gums. It's our gums that are developing the disease. We can call it gum disease and we'd be talking about the very same thing. But I described earlier how we can have bone loss. And what we do, we have our hygienist measure the pockets. They take a little instrument and they see exactly if there are any pockets around each tooth. And if they are, that means that there's bone loss. And there's also separation of the gum from the bone. And if those pockets keep getting deeper, our patients cannot keep them clean. So they have to come back and have a cleaning more and more often. But sometimes it gets to the point, if the tooth hasn't loosened already, that they're going to need gum tissue surgery in order to reattach those gums to the bone that's left. But the language is merely, when we talk about periodontitis, we talk about gingivitis. Gingivitis, that's also a gum tissue infection, but it's at the top part of the tooth. It's not down in the bone, and the pockets that I mentioned are sometimes like 2 or 3 millimeters versus 6 or 7 millimeters or more with periodontal disease. Gingivitis, we get a patient back and we can clear that up within one appointment, and the patient can just maintain that level of potential pocket in their gums. But with periodontal disease, this is where we have the potential for infection, because if we can't get those patients back, those deep pockets, as the food particles and plaque keep developing down in that deep pocket, that's when we start to get infection, pus pockets, and issues that can lead to severe disease of other organs in the body.
Dr. Gist, are African Americans particularly susceptible to any disease states that actually are detected in the oral cavity?
Actually, we are pretty much orally healthy, just like everyone else. I think the specifics for the diseases that we get are because of lack of attention to going to the office. Although I know from personal experience that Native Americans and Native Alaskans have tooth decay that is just
tremendous.
It is beyond belief, the rate of decay that they get. Our rate sometimes is excessive, but it just doesn't approach them. So I do know there is a hereditary factor that is inherent in some groups. But African Americans are affected. But I believe if we could get them in the office at an early enough age and get them back on a routine basis, that we can prevent any problems, just like we can with other segments of our population.
But here again, the oral cavity being the gateway in many instances to the rest of the body, what kind of disease states that people don't necessarily relate to oral health, there may be an association or a connection with that you see in dental practice?
We see it every day. Patients that really are afflicted, number one, under care of a physician and getting prescription medications, especially diabetics, we can detect that right away with the state of their gum tissue. And if they need an extraction, for instance, we can take that tooth out, but it takes at least 3 weeks longer than the normal extraction that we do with a healthy patient. Take that much longer to heal.
3 weeks longer?
It takes a good solid 3 weeks longer, sometimes longer than that. But they're slow healers, and we are aware of that problem, so we have to take special care. We noticed that, and we look for, when we do our screening, spots, like red spots on the cheeks, on the tongue, on the gum tissue, or anywhere, red or white spots, because sometimes they indicate that there's something wrong, such as a beginning of oral cancer. We check the throat, because now we routinely do screenings for HIV and other diseases of the throats. And so far, there's one case of throat cancer that we found at our office. And I understand that that happens pretty frequently. We look for traces of disease from smokers and from smokeless tobacco users. Smokeless tobacco is just devastating.
It's not safe.
No, not at all, not at all. So, and we see instances where that is just really destructive primarily to gum tissue. Tongues. We look at the tongue and we detect the back of the tongue, both sides, and the bottom for any type of a problem, any type of spot. Tongue bites, cheek bites, and all of those. Our first suspicion is that we're talking about the beginning of oral cancer, and we have to eliminate that diagnosis just to make sure that our patients are healthy.
Most of the dentists now routinely are checking blood pressure in the office, and I'm sure you're finding elevated blood pressure in people who are there for dental care.
Absolutely, absolutely. It's amazing how many patients that we are unable to treat because the blood pressure has risen so high. We're not able to give them any type of local anesthesia. Our hygienists can't clean their teeth if their blood pressure is too high because, number one, there's a nervousness factor involved, and that makes the blood pressure even worse. And number two, they're prone to bleeding. And if they start bleeding, sometimes we can't stop it. And it's been our experience that we've had to send a very significant number of patients right from our office to either to their physician's office or to emergency.
All this being considered, do you see an issue with black men having a fear of coming to the dentist?
Yes, I do. Now, we're macho. And for the most part, if we feel healthy and don't feel the need to go to the dentist unless we have some kind of a sensitivity problem or a toothache, then we have a tendency not to go. And that's too bad because it doesn't give us a chance to really sit our men down and talk to them. Tell them that they're just as susceptible as everyone else to mouth disease, and it would be to their benefit if they would come in, let us check them out, and if we find something going on, to let us fix it. Because they can't see everything. They can't see in between their teeth. When we take x-rays, we can pick up cavities and also bone loss. So there are just a multitude of problems that develop when they just refuse to come to see us on a routine basis. Many of our young males ignore us because they're just busy doing other things, or they get into other activities that they think are more important than their health. And I know both physicians and dentists are waiting for these young men to come in and let us just help them help themselves.
Very true. May explain why we see more oral cancer in African American men than most populations.
Yes.
And very good. We're going to go to a break. We'll be right back with more primary care.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please
Don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Welcome back. We're here with Dr. Raymond Gist, who is a dentist in private practice here in Flint, Michigan, and former president of the American Dental Association. Dr. Gist, why do black men represent a true disparity, therefore having more oral cancer than any other populations? I mean, we know that access is always an issue in anything involving healthcare, but are we looking at any particular reasons for this?
We are different because of our activities. Primarily, that's the full reason. Many families, such as my family, can't afford to take their sons or daughters to the dentist because of that lack of access issue. And if they're not going to the dentist on a regular basis starting at a young age, then they don't feel the need. And what happens is they get off into other things. Now, fear is a factor also, although you won't find many to admit it. But fear and finances are the two biggest reasons that we don't see underserved or underrepresented patients. But black males stand out, and again, because we had that macho feel that this is just not necessary.
And if you couple that with cigarette smoking, which increases the incident, alcohol usage, which also increases the incident, and being a black male, the numbers go even higher.
Oh, absolutely, absolutely. And we see some cases of meth mouth, and that is just an absolute devastation of their entire mouths. So those that take those drugs, meth and others, also aggravate the situation, with their mouths. I've had many patients that come in on one occasion for one tooth to be fixed with a mouth full of disease, but not wanting anything else done, and they'll come back when another tooth starts to ache, but just won't come back for routine dental care.
Does pregnancy represent a particular problem in dental hygiene and dental care? you know, especially with the hormonal changes that a female may experience throughout the 9 months of pregnancy. Are we experiencing any real issues there that need to be highlighted?
Well, there are 2 or 3 issues, definitely. What we see with pregnant women, the hormones affect the gum tissue. And generally, we have a condition called pregnancy gingivitis. That means that the gum tissues are starting to get infected. And we have to catch that before the patient develops periodontal disease, because that will affect the development of the baby. So yes, that's something that we really have to keep an eye on, and we have to bring our young pregnant patients back sometimes 3 or 4 times a year to make sure that those teeth are cleaned and those gums are healthy. That's primary.
There's the old controversy about putting fluoride in the water, public drinking water. What are some of the pros and cons as you see it after many years of experience of actually addressing this issue?
Actually, this is why we like to put fluoride in the water system, because the percentage that we put into the water is so minimal and still effective that it causes no problems medically at all. We haven't had any problems that reported about any damage from fluoride. This actually was introduced in the state of Michigan, in Grand Rapids, in 1945. Mm-hmm. And Michigan has had fluoridated water for all of those years. When we saw the results of fluoridated water versus non-fluoridated water, the difference was just incredible. The number of cavities that were being reported before the fluoridation dropped by at least 60% when our patients started drinking fluoridated water. And this was universal. It doesn't impact our race or ethnicity any other way than it does with whites. And it is actually one of the most beneficial ways that we can prevent tooth decay and help to keep it from coming back than any other method. And that's why we continue to promote fluoridation, you know, as often and as long as we possibly can.
Dr. Gist, your practice is here in Flint, Michigan, and you know, we've had this highly publicized water contamination with lead situation that has gone across the country. As a dentist who's been taking care of this population before, during, and after, tell us how this has affected the oral health of this community.
Number one, our patients now, when they come to the office, ask us about lead in the water. Are we using Flint water? And actually, we're not in the office. We have our own system, of water, and we put bottled water in our closed system. And this is to allay the fears as much as possible. What we don't know is the long-term effects. And you've heard about, of course you have, about how the lead will settle itself into bone, into tissue, etc. And over a period of time, there's going to be some type of consequence for that action. And we don't know how it's going to affect the mouths. And that is why we really just wanted to emphasize fluoridation, number one, to try to prevent tooth decay from being included in that particular problem. But then we've got to keep these patients coming in, check the level of their gum tissue, and we check for pockets around the gum tissue to make sure that gum tissue stays healthy. It's the bone. We take radiographs, x-rays of the bone, and if the bone level starts to decline, like I described earlier, that happens with periodontal disease, then we'll know that that the lead has settled in and will have an effect on the bone in the mouth also, in addition to what it does to the body. So it's going to be a long-term process to keep track of and monitor the health of the mouth health of our patients, just to see exactly if there's going to be any consequences because of this lead issue. What
is your hope for the city of Flint as they begin to rise from this crisis?
Actually, you know, this really, in my view, brought the city down to a level where it appeared that we couldn't just climb our way back out of this. But I know we can. and I know we're making progress. The politics are slowing our progress, but what I would like to see is our citizens band together, especially our city council and our mayor and all of those that really have the power to help us get ourselves back together to become healthy again. And it gives us an opportunity to educate our patients as much, or patients or potential patients, as much as possible. And those that we're seeing now are really happy with the results, and they're coming back to let us monitor, to get that message out to those that we haven't seen yet, and to get them into our offices, and to get ourselves a healthy population, and to make everyone realize that no matter what the odds, that we are able to climb back to a level where we can be successful, not only as adults, but bring our children along also. That would be my view, that would be my wish.
Dr. Gist, thank you again for joining us on Primary Care. Hopefully we'll do this again
All right,
sometime soon.
forward to it.
Thank you for joining us on Primary Care. We'll see you next time. For more information about the show and our guests, visit our website at primarycare-tv.com and continue the conversation on Facebook and Twitter.